Emily. I'm an esthetician and laser tech here at Bliss Yoga Spa. I've been with the team for about 5 years now and in the industry for 11. Today we will be doing a photorejuvenation facial, which is also considered as a photofacial. So to start off, I'll explain a little bit about the difference between an IPL photofacial and a true laser photofacial. So if we think about IPL, we're thinking about intense pulse light, we're thinking about broadband. So what we're doing is we're actually treating reds and browns. So we're treating pigment and veins all in one, kind of all at the same time. With the G-Max Pro, what we're doing is we're doing it one treatment at a time. So it's a little bit more focused, and we'll be able to treat pigment, then redness, and then veins, all in one treatment, but one after the other. Personally, I quite enjoy doing this treatment because I find I'm getting really strong results with it. We're going to be doing Lindsay's pigment today, so we'll be doing a full face of pigment, and then after that I can transition into my veins. With Lindsay, she really doesn't have much redness, so I'm not going to be doing that treatment, but again, with our consults, we can decide what we want. If you need all three, we can definitely do all three if you mostly want to focus on pigment. So it's very customized, very easy to custom make every treatment, and not say that word. Customization. At the beginning of your treatment, you want to prevent, you don't want to be using any like vitamin C's or retinols for at least 3 days prior to your treatment. So I did tell Lindsay that about 3 days ago, so she has not been using it. For today, what we're going to be doing is I will be covering the machine. I'll be going through your full face. You're going to feel a little bit of heat. This is the type of treatment that you don't need to really act tough. If you feel heat, you need to let me know, because what we want is that heat in and out. The pigment is lower into the skin, so what the laser does, it cuts in that light, breaks up the pigment, oxidizes it, and brings it to the surface. By doing so, after your treatment, you're going to notice your pigment's going to be a little bit darker. It won't be anything crazy, but you'll just look a little bit more freckly. A couple days later, it's almost going to start to look a little bit like coffee grounds. What you want to do, you don't exfoliate it, let it slough off naturally, and then you'll notice a lot less pigment. Any questions for today? No? Perfect. Okay, so I'm going to put some goggles. So what I'm going to do is I'm going to start with your cheek on this side. I'm going to turn your head a little bit. So I'm going to go down here. 1, 2, 3. How's it feeling?
It feels good. It feels hot, but it's not staying.
Perfect. Like now, exactly. It's kind of like a little snap and then it goes away. As you can see, it's a pretty quick treatment. Sometimes if you have a bigger pigment, you'll feel a little bit more of a snap, but nothing crazy. It dissipates really fast. And that's one side, one piece of the cheek. Then I'll come over to the other side. 1, 2, 3. Beautiful. How's this side feeling?
Feels normal.
Perfect, like nothing happened.
Yes.
Perfect. So with this treatment, sometimes I will do more than one pass. When that's necessary, I will typically get some ice packs just to cool down the skin. It feels nice too. Then we can kind of keep going and treat more aggressively. I could either do, like you can see the circle is a little bit bigger. I I can also go in and treat afterwards bigger spots that I want to kind of zone in on. If you have melasma, this treatment might not be the best for you. However, we can pre-treat it with some environmental prep solutions and as well as microneedling. This is really good for lighter skin types, although I can treat certain ethnic skins. So that's why, again, a consultation is super important because then we can decide, is this treatment best for you, or do we want to take a microneedling route? Do we want to pre-treat with any products? So again, consultations are super important so that we know which treatment will be best for you. And I'm going to go into your chin. Sometimes forehead can be a little bit spicier just because there's no fat on the forehead, but then again, you always go slower. We always have times for breaks. I can always adjust the machine setting. I can even like pre-ice pack it to make it more comfortable. So no matter what, you're never going to be in pain or gripping the bed. We'll always make it good for you. Here. And as you can see, I kind of tend to go a little bit slower because why not? There's no rush.
So Nadine was wondering, I know some people have facial hair. Would they need to shave before this treatment?
I mean, you definitely can shave before your treatment if you want to. However, like if it's just a little bit of peach fuzz, honestly, you might just smell a little bit of burning hair, but it won't be anything crazy. If you're more comfortable with shaving before your treatment, go right ahead. You can always like come in and dermaplane a week before. It really depends what degree of fuzz you have. Like I said, it might just be a little bit smellier, but nothing substantially super uncomfortable.
Good.
Good. Are you feeling a little bit warm on the
I
forehead?
can feel the warmth on my forehead.
Perfect. How's the sides?
They feel fine.
Alright, I'm gonna retreat the sides. So as you can see, that's pretty much a full pass on her whole face, and like it went by pretty quickly. So it's a pretty in and out treatment, minimal downtime. Like I said, the darkening of the pigment is barely noticeable. So you're not looking at like a scary amount of downtime. You can always cover it with mineral makeup anyways after like day 2, day 3. Okay, I'm gonna go to your cheek again. Beautiful. So what I can see is I can see the pigment getting much darker. That's really good because that means we're getting all that pigment up to the surface. How's the forehead feeling now?
Feeling okay.
Are you feeling like tingly a little bit?
On the forehead?
Yeah?
Or it's gone. Yeah.
No, it's pretty much gone. Perfect. How are these feeling?
Those are feeling a little tingly.
A little tingly? Perfect. So you'll see throughout the treatment, I'm going to ask a lot if you're feeling heat, if it feels tingly, just because I want to know where you're at, how's it feeling, see how many passes we want to do. Because right now I can see Lindsay darken really, really nicely. Even her forehead is starting to look really freckly, so that's a really good sign, meaning it really got out to the surface. We did notice a little bit more pigment on the sides, which is pretty typical, which is why I did a second pass. And it looks nice and dark.
So someone's wondering if this treatment is appropriate for someone who has active acne.
So this treatment can, for anyone that has active acne, depending on, like how active, I would say either come in for a consultation. We will be having Sarah later coming in for an active acne treatment. So feel free to watch that one too. She'll be able to talk about it a little bit more. It's called the mastectomy laser. For today, I think if you do have any active acne, we might want to treat those first. And then once the acne is gone, then we can kind of go in and worry about any pigmentation scarring. Then we can treat it with the photorejuvenation, no problem, with a really high success rate. So I'm just going to have a look at Lindsay's veins just so I can see where I'm going to be treating these. I have a couple around here. So you'll see with laser veins, typically people have them kind of around the nose, even up the nostril a little bit. So those are super easy. I always say it's kind of like the easiest treatment we can get done. The pain is minimal. There's no downtime. You'll notice a little bit of redness. That'll go away within the day. If you have any cherry angiomas, so those little red dots that some people get on their chest or even on their face, I can remove those as well. I can also do veins on the legs. So those would be the more smaller, typical, superficial little spider veins. I can treat those as well. How's everything feeling? Perfect. So, I will be switching out my handpiece. So every handpiece that we have one specifically for veins. So I'm just going to do that on the machine quickly. Usually people don't get to see that part because they have their goggles. Now you guys kind of get to see me switch out some stuff. I wish I could have elevator music while I do this. So in a laser for this machine, we have two different wavelengths. So we have our alexandrite, which is going to be more attracted to pigment. So when I do pigment or laser hair removal, I'm going to use the Alex setting. Right now we're going to be doing veins, so think more blood. So we'll actually be doing the Yang setting, which is a different wavelength. The laser is going to be attracted to the blood flow. So with the veins, what we're doing is we're actually delivering a heat into the skin that goes straight to the vein, and then it'll coagulate all the blood in the vein, and then it's going to cause it to collapse, which is why it goes away immediately. You'll also feel kind of a shot of cool air. That's the liquid nitrogen to help protect the outer layer of the skin so that it doesn't burn. Most of the time I find people tend to jump a lot because it's a really quick shot. So the first one always kind of makes people jump, but it really doesn't hurt. So I'm just adjusting my treatments for Lindsay. So again, every skin type, every person that's different will be put in different kind of settings. So everything is going to be custom for you. So Lindsay's veins are quite small, so I will be using my lamp. And I don't need the goggles for it, thank goodness. Okay, so I'm going to come over here. You're going to feel a little shot, 1, 2, 3. And that is it. And then this one I can come in and manually remove every little vein, which is really satisfying to do. How's it feeling?
Feels cool,
Right?
not uncomfortable at all.
No. Have you had the veins before?
No.
Oh. I tend to get quite a lot of little veins, so I really love this treatment because it's so quick and easy, and it works fast. Sometimes you'll notice that the vein will go blue. That's good. That means all the blood is coagulated. It just hasn't collapsed, and then that will go away in a week. If it's little cherry angiomas, those will go blue, and then they'll kind of just fade on their own.
Is there any aftercare?
After your vein treatment, if you're doing it on the face, there's really no aftercare. However, if you're doing the legs, I always recommend wearing like compression pants, like tight leggings, and then maybe avoiding like vigorous exercise for about 24 hours. But apart from that, yeah, that's pretty much how easy it is. It's just having a look, seeing a little vein. Do you ever get cherries, the little red dots?
I think I have a couple, but I haven't really noticed them lately, but I have some in the past.
Perfect. A lot of times people will either get them on their chest or their neck, or even a lot on the stomach.
Or you can see them
Yeah, I can
more
see a little bit here. I can see one there.
Yes, it's correctly.
It is freckly.
What are some of the areas you can do photorejuvenation?
So with the photorejuve treatment, you can pretty much treat any body part. So even if you had like a scar somewhere that you notice has gotten darker on the body, you're definitely can treat those. I have a lot of people that have that. You can do age spots on the hands. I know sometimes those are not the nicest to look at. So we can always treat those. So pretty much any body part that has any freckling, you're more than welcome to come in and get treated. Again, it's quick, it's easy, it's painless, and it's a really aggressive treatment in a way that you see really big difference. Like this isn't one of those treatments where you're like, oh, I think I can tell. You'll really, really notice. If you have a really big pigment, sometimes it almost get like a little bit crispy, which is really good because that means we really got in there. And then you'll notice a really big difference, and it'll just slough off, and your skin will look really good after. I notice too sometimes for anti-aging, a lot of people think it's just the fine lines and the wrinkles, but when you're treating pigment, you're not getting that discoloration in the face, right? So you're not getting as much dimensions. The sunspots don't get like stuck in the fine lines and wrinkles. So if everything is nice and even, that'll give you that more youthful look much faster.
Is there any reason you wouldn't be able to do the veins or the photofacial if you have tattoos?
So with any laser treatments, we don't want to treat anywhere there's a tattoo. Obviously, I can treat close by, but I don't want to treat over a tattoo with a laser because, again, pigment, right? And tattoos nice, so we don't want to ruin those. So always let us know if you have any tattoos. If I can't see them right away. But as you can see, Lindsay does not have tattoos on her face. So she does have like microbladed brows, but again, I could just use a distance and treat around them. I just wouldn't treat her eyebrows themselves. Yeah. Do you have any questions?
You said don't exfoliate for a couple days?
Yes, so after your treatment, no exfoliation. So nothing with a grit or even an acid. So stay away from that for about a week, at least until all the pigment has completely sloughed off. Just think of it as like leaving the pigment there naturally and letting it fall off without picking at it. Do not pick at your pigment, please. That is probably the biggest no-no. Let the skin heal under without the pigment. Any vitamin C's, glycolic, salicylic, retinols, you do want to wait until, again, the skin has completely sloughed off.
So what would you recommend for cleansing and aftercare?
Keep it basic. Cleanse, tone, do a nice moisturizer. You might feel a little bit like dry, so you're more than welcome to use a more like hydrating moisturizer. Environ does do the super moisturizer that you would really like too. I started using it. I absolutely love it. So we have it in a bigger size at the same price as the regular size one. So who doesn't like a nice deal? You would apply this one AM and PM. Just keep your skin hydrated. Treat it like it's skin that just had laser. So be gentle to it. Be patient. It's only about a week, and then it'll be okay. If you do have melasma, I have these two from Environ. So this is your Melaprep lotion. You're going to apply a little bit of that on the melasma, and then mix A and B in equal amounts and apply that as well twice a day. By pre-treating this, you'll help break up the pigment because it is a heat-activated pigment. That's why we don't like to do laser. We can also do microneedling after, which all of our laser skin services and our embellish shape will be 25% off for the whole weekend, as well as our Environ products will be 15% off. How are you doing?
I'm good.
Yeah, I think we're gonna do another couple. How's your forehead?
It feels, there's a couple spots that feel
Up
warm.
here?
Yeah,
Yeah.
right up there.
Yeah, that's where the
That's
darkest pigment, yeah.
That's it. Everything else feels normal.
Perfect.
Would you also caution against like sun exposure, like make sure to wear sunscreen and find spending time outside? Or...
Absolutely. Sunscreen is an everyday thing. You'll hear me say that a lot and preach that a lot to everyone. You should be using sunscreen every day. When you do get laser treatments, it is very important for you to be extra cautious of the sun, especially photorejuvenation. We're literally treating sun damage, so don't not let sunscreen and go out in the sun. It's just going to make it so much more prominent, and you will have to come back. Every purchase that you make, you will be entered to win a 1 of 3 day Jane Iredale Day Tripper set, which is a mineral makeup, which is really nice. Yeah, they do make great makeup. After your treatments, you're more than welcome to apply some Jane, and they do have SPF in most of their product, which is really, really great for laser, because then you can help your makeup look good and protect your skin at the same time.
I have another question about this treatment.
Yes.
Is this like a one and done, or would this be something that you could see like progressive changes as you take more appointments or get more treatments?
So with this treatment, you're going to want about 3 to 4 treatments every 5 weeks, or until we're satisfied, really. So we could do one, and if you're happy with the look, then that's good. We could even go in later in your 5-week post and just treat the one spot that was a little bit stubborn. Everyone's different. Everyone's lips pigment differently. So I always kind of tend to stay away from giving specific numbers. If you want like absolutely no pigment left, not one little spot, then obviously we're gonna have to do a couple more treatments. But if it's like one specific spot that bothers you, then we can treat that. Again, with these treatments, you don't need to do a full face every time. If you just want your lower face, if you just want your forehead, we can always do that. If you just want veins, we can also do that as well. So we can always, again, customize everything, but typically I want between 3 to 4 treatments, about 5 weeks apart. If you don't protect your skin, I will be seeing you next fall or winter. But some people like to come in about once a year just for a little touch up as well. If anyone has any questions, feel free to ask. I'm going to switch the headpieces up again. Perfect. Well, thank you everyone for watching. Hopefully I got to answer a lot of questions. Have a great day. And if you do have any other questions, you can always contact Liz and we will be more than happy to help you out.